Where do you see, just from an industry perspective overall, 10 years, 20 years, 30 years from now, with the advances that we're having in generative AI, will we even need doctors? Will we even need the specialists to the degree that we do now? I mean, it's been this overburdened industry for such a long period of time, but I do think that we're going to keep having advancements in the capabilities of these models, and the more fine-tuned and the more custom that they are, they're already identifying and diagnosing diseases that doctors and specialists aren't necessarily able to pick up, and we're only 2 years into this technology. So where do you see, from a long-term perspective, this industry moving overall in working hand in hand with AI and having more and more access to custom data?
I'm not going to write the obituary of a physician yet. I think it's a very valuable profession. They add a whole lot of value to the entire healthcare ecosystem. I think a whole lot of things that we are building, what other digital healthcare players are building, and there's some amazing build that's going on around the world right now. I think they're all going to add a lot of value. They're going to completely support and complement a physician's abilities. Today, I think a physician, unfortunately, is bogged down by a whole lot of administrative and non care based activities. If those can be taken care of by some of the solutions that we and others are building, I think the provider patient relationship can definitely enhance itself. The patient himself now can become an important player in his own healthcare journey. If you recall, our healthcare journeys in the past, we were never aware of what was happening to us. We would just go to a doctor. They would tell us what potential problem was. Then they would give us a set of instructions that we need to follow. Some of us would dig a little deeper. We may ask friends and our relatives who are in the healthcare industry what some of these things mean. But I think today, standalone, a patient can have a lot of intelligence about his own health. And I say that intelligence must come from a place of accurate information. I don't mean just search and find kind of information, right? So for me, the physician will continue to be out there taking care of people, complemented and supported by technology. And I always call new age solutions as your extended staff. They're not human beings, but yes, they are members of the staff that support you. And so I think there's going to be the element of human intervention in healthcare that's going to continue to be there, but it's going to get severely enhanced. And I think that's going to be where the impact is going to be.
Yeah, it's going to be interesting to see how this plays out, because I think it applies to so many different industries,
It does.
and it's one of those things where we can't see past, 6 months or 12 months or 18 months out. What do you think are second order effects of AI within healthcare specifically? And by second order effects, whenever there's a brand new technology, we immediately think of, well, how can this apply to what I'm doing today? Right. And so it's kind of taking what already exists, taking the models that currently exist, and saying, let me bring this new technology in to do what is currently being done better. And so you're seeing this within the space, as we've been talking about, of exposing more data, having more unstructured data that can be communicated, translated, understood in and through generative AI, right? And also just bringing in kind of disparate data and being able to unify in a more logical, complete way. But this is still kind of taking things that have already existed and working to stitch them together. There's always these second order effects that end up kind of happening 3, 4, 5, 10 years down the line, which are fundamental shifts in how we do something at all. So an example would be, we used to not have smartphones, right? And so we used to call a restaurant to order food. And now there's kind of this entire ecosystem of being able to kind of do delivery of food. You can deliver packages through Uber. You can order a car directly to you. And so transportation has kind of shifted entirely with this new technology that was enabled by having a personal computer in your pocket at all times. So where do you think the second order effects, if you have any ideas on how that's going to impact just what we even know healthcare to be today?
Yeah, I think you rightly mentioned, we've already seen those second order effects in multiple industries, right? And like it's there in other industries, you will see it in healthcare as well. Um, Technology, and this is why I'm very, very impressed with what artificial intelligence kind of provides us. Technology has been evolving over a period of time, and we've always been told that technology is an enabler. It's an enabler to how you've been doing business or how you've been doing your managing your industry. AI for me is not just an enabler. I think AI is bringing across a completely new revolution in terms of how you are imagining your industry or how you are imagining your workflow. So for me, organizations that are going to take AI and kind of place them over their existing business processes are not going to find too much of advantages because you still insist that your process or your workflow remains the same, and you're looking for a little bit of an automation or a little bit of an intervention, potentially using AI. Instead, if you keep AI at the center of it and relook at the entire workflow or business process, you're going to have a brand new business model. And what does
Correct.
that mean?
Exactly.
So within healthcare, yes. So within healthcare, for me, that means today I am dependent on falling ill, then having to go to the physician's office, meeting with the physician, then him instructing me on what my issue is and how I should look after it, potentially pop in a few pills, and then hope that one day I'm feeling better. That's the workflow that we have in a very basic healthcare setting. If I were to alter that, I would say, why should I fall ill to even start looking after myself? Right? Can I have enough information that kind of indicates towards things that could potentially happen to me? And can I circumvent them before that incident actually happens? And then to do that, and eventually, if it does happen, do I really have to go into a physician's office? Can I be in touch with the physician through other means? Right? And can there be layers of care even before I meet the physician? And can I take care of that instance in multiple different ways before treating it as a situation where I have to check into a physician's office or to a hospital and then undergo treatment plans as a reactive mechanism versus a completely proactive mechanism? Now, we're seeing a few of these nuances happening with value based care in healthcare, right? But even in value based care, and value based care has been around for some time, but unfortunately, we are not yet seeing physician practices or ACOs, and some of the ACOs are doing some amazing work, but we're still not being able to see fully capitated models coming in where the practices are able to take on the full risk. And the reason they're not able to take on the full risk is because to take the full risk, you need good amount of data, good amount of factual data to be able to make those decisions. So I see a huge impact that AI will play. And I don't even say it's going to take too long. I want to say in the next 2 to 3 years, we're going to see that impact in healthcare.